Hi, Maureen O'Hara here on the ODA service, just going over the second page of the post-discharge care instructions. So we want to put in what the dressing is going to be. I usually fill this out on Wednesday morning when I'm doing the rest of the orders for the patient, and you know ahead of time, I would say 99% of the time, what the dressing is going to be. If you're wrong, you can always correct it later. We want them to keep it clean and dry. We want them to wear their splint 24 hours a day, 7 days a week until they are cleared at the clinic appointment. We prefer that they not drive until they've been cleared, meaning until they get their sutures out. If they want a copy of the information about the hospitalization, they can get that from medical records so they can take it to their primary care provider. The physical therapist and the occupational therapist will check off that they have signed off on the patient. That's what this section is for. That way you'll know that unless you also want to go and read through the chart, this is one way that you can find out that they've signed off on the patient. Then if the patient was not having surgery and we're not going to follow them um, after their hospitalization, then we would check this off. Otherwise, we want them to come back and see us, and we can check off our clinic appointments here. So this patient, for example, had a right great toe amputation, so they're going to come to the Monday clinic. Um, they would have had their wound check appointments on 214 and 221, but in this example, 221 was a holiday, so it's just going to be a wound check and a suture removal. And then we want them to follow up at their regular clinic for their diabetes because we're not going to take care of their diabetes when they come back to clinic. Then on this page is just information for the patient. If they have problems, then they need a sooner appointment. They can call the triage nurse. I like to circle these numbers for the patient so that it stands out, especially for the Spanish speakers. Want them to know what clinic they belong to. So people with 2 feet belong in the Monday clinic. Patients with 0 to 1 foot or upper extremity belong in the Tuesday clinic. This is the number they can call to reschedule, and if they need a refill on their pain medication, they can call the office and leave a message for one of us to refill the medication. And then in terms of return to work or school, the disability is 4 months for toes and metatarsals and BK revisions, 12 months for Symes and above, and some Charcot abnormalities, and 1 or 2 months for non-surgical patients, or sometimes revision patients also can be a shorter period of time. And then you want to sign it, print your name, put your number, put the date on it, put it in the chart, and then this will be gone over with the patient when they're being discharged by the nurses. And so those are all the forms that will come in that Tuesday bundle that will help you out with Tuesday pre-op, Wednesday surgery, and post-op.